Thank you, Dr. Gaurav. And the good part is I don't have my presentation here.
So you're going to talk
so I uploaded. Now probably I'll have to talk extempore.
You can do that, I know that, so absolutely fine.
So, good afternoon, everyone. And I'll be sharing my thought process and my experience about the thing which I am yet to answer and I am yet to understand about it. My refractive career had been a very roller coaster ride. So every time you take a loan, you go bankrupt, you buy a machine, and you again start struggling from the beginning again. So the first question comes to my mind whenever this topic was given, ROI and marketing and everything. So first question arises is, why do you want to go for refractive? Why do you want to buy a machine? There are three possibilities. Either you are a very good cataract surgeon, you are earning a lot, and you want to upgrade your practice. Second thing might be a person like me who is tired of monotony, who doesn't want to do cataract, he is not enjoying his procedure and wants to get over to refractive to understand the thing. And third possibility is you are earning so much that examiner gives you a good amount of depreciation. I am yet to see a fourth possibility. So let us discuss one by one. You are a very good practitioner, you are earning, you are doing premium cataract surgery. Your other fellow practitioners in other city or in your area, they are doing good. They also have refractive. And somewhere it starts pinching your ego. You feel कि अरे वो 30,000, 50,000 वाली cataract करता है, 50 करता है, why not I have that machine if he has. And mind you, I have come across these examples because I was visiting 16, 18 centers across the country. So without even understanding our need, people used to jump. उन्होंने Z50, Z100 लिया, मैं भी Z100 लूँगा. उन्होंने 500 लिया, मैं भी 500 लूँगा. उन्होंने 500 लिया, तो मैं refractive suite लूँगा. So, I feel कि you have to understand what kind of practice you are into, what your demography permits you. Because you are doing 100 cataract surgery a month, but you don't have premium IOL practice, which can actually generate you a good amount of patient for yourself. So I don't think it's an ideal situation to go for refractive equipment. If you are doing 25, 30, see, reverse is true. If you are a good cataract surgeon, putting up a refractive platform will give you more cataract surgery. But mind you, your refractive installment should come from your cataract surgery then. So, the area where you practice, the clientele you are catering to, the competition. See, my talk today will be very transparent. So, try and understand my feelings. The thing is, any company, means say in 2004, 2003 when I bought an equipment, so while selling you the equipment, they'll talk about technology and the best part they will tell you is you will be the only one having this. So you buy the equipment and you start marketing for them. So I bought Zyoptics and then I started shouting from the top of the roof, I have Zyoptics, I am providing Zyoptics to everyone. And within 6 months, the next Zyoptics is launched in your nearby area. So any company will create a competition so that it will increase their as well as our business. Now a logical question comes to mind. In refractive, whether you want to market the company or you want to market yourself. Because the moment you talk about technology, the moment you talk about certain things like Contura, Zyoptics, every doctor will shout. But indirectly, try and understand, you are building a brand for the company. You are not building a brand for yourself. It took me almost 10 years to realize that. Because you buy equipment, refractive is a very demanding thing, and you have to be the best. So every 3-4 years, company will come with new platform, and you will keep on taking loans every time. Whether you buy the equipment on deferred payment, you take a loan or anything, but every 5 years you will renew your loan. तो मैं तो रिफ्रैक्टिव को सीसी बोलता हूँ. So don't market for the company, market for yourself. This is what I feel a lesson learned with lot of hard work. Second thing, if you want to start your practice, I would suggest if you want to start in a group, there are 3 possibilities again. You individual, buy the equipment, enjoy all the privileges, but at the same time, your friends won't send patients to you. Second thing is entering into a group practice where you all contribute for the equipment and start running it. It's actually ease out your burden, but at the same time, you are not owning the title. The third possibility is you set up a neutral center and call your friends, get associated, and start a neutral center concept. So it all starts with neutral center. But in my experience, whatever practices I have come across, group practice doesn't survive. Because it starts with a noble concept and then turns out to be वो महीने के 4 ही लाता है, मैं महीने के 10 ले जाता हूँ, and then the dispute starts. So I have come across almost 12 centers like in India where it started. Most of the companies, they will help you. Sir, ये कर लो, ये group form कर लो, ये कर लो. और 12 सेंटर ऐसे हैं कि जहाँ से वो मशीन 6 महीने साल भर में उठाया गया है फिर से. Because the center didn't do well. Do we really think that in spite of 30 ophthalmologists coming together, you cannot build a practice of 40 patients a month? Then it's a time to introspect. So, when we discuss about buying a refractive, means I'm sorry, I'm sounding discouraging thing. Dr. Pranay is looking at me constantly. He is starting another venture. So, but my duty is to point out all the negatives before I start talking encouraging words. So, ideal situation is like-minded people coming together and buying equipment. If you alone want to buy and test the water, I feel better to start your refractive career with a refurbished machine, develop a volume at your end, and then jump into upgradation. Because upgradation is the motive. When being a cataract surgeon, you want to get into refractive practice. Upgradation is the motive where you want to develop, want to have a good name in refractive also. So start your career with refurbished machine and get into upgradation once you achieve the break-even. In refractive career, normally ROI जब calculate करते हैं, ROI हम we talk. So कोई भी business में, a normal business, any company, they talk about ROI, you should have a break-even within 1,000 days. But in refractive, I feel the ROI extends up to 4.5 years. So you have to calculate at your end the economics for 4.5 years, then only you will survive and you will succeed in refractive career. You people won't agree with me, but you are second generation ophthalmologist having refractive at So few things I have learned from Dr. Gaurav. So whenever I used to buy new equipment, I used to call him, discuss the things. And second thing, every company you go will talk about how updated and how they are the best. But if you are starting your refractive career, don't go for the best, go for what suits you. Buying an equipment of 1.5 crore and achieving a break-even is far more easier than buying a super technology and then spending entire your life in marketing it and to have a break-even for 5 crores in 5 years. And the last option, a mad person like me, who has passion. So every 4 years, keep on changing the equipment and doesn't have his own house till date. But you have to be absolutely passionate to have this kind of thing. But ideally, logically, I won't suggest anyone to go for it and do this way. You have to be, don't go for the best. Try what suits you. Try what suits to your practice. Because I won't call myself as a successful refractive practitioner. You are successful when you are able to achieve the ROI as desired for. You are able to achieve a name for yourself, and you are able to achieve a brand of yourself. Then only you will be a successful refractive practitioner. Thank you very much.
Excellent talk, Dr. Darak, and I think that's experience speaking from there. And yes, all the challenges that he's explained, but there's only one thing which I would like to add here at this point. Something which has come up over the last few years is that you can actually start your refractive surgery career working for an institution which is fully equipped, has almost everything, and you could get a good training, and so that's the only thing which has changed from the time we started working. So there is that option for young surgeons now to join up in a center which already has good refractive surgery equipment available, and you can join and start doing it. And there are good numbers of such places who have invested. So best not to invest into it yourself till you are established as a surgeon and experienced, and then you may be more, and then have a good practice. So I think he's covered up almost everything. This is the only thing which I thought might, ma'am, anything that you would like to add to this?
For me, this is total ABC. I have no idea, but it's fantastic. You've been so practical,
Very words of wisdom. And I think the other thing is that the world of marketing has changed so much in the last few years, as we've all seen. COVID times have changed things. There was print media which used to work very well 15, 20 years back. Now it just doesn't deliver. The digital marketing has taken over, and then improvisations in digital marketing. So you have to not only be a good refractive surgeon today, you could have the best machines, you could have the best hands, and still it is not enough. Sometimes, you need to kind of beat the system as well. So that's the other thing which I would like to point out. Be prepared to, take that as well along with you. Just being a great surgeon and with the best equipment and doing good work is not enough anymore.